Hi everyone. Today we're going to talk about psoriatic arthritis. So for this presentation, I've made a handout that everybody can view while we're going throughout the presentation, and I'm just going to place little screenshots of the handout up on the screen and do a voiceover just to help expand on each topic. So with psoriatic arthritis, we're just going to actually talk about what it is and what causes it. So it's etiology and pathogenesis, so just what brings it about. We are going to talk about signs and symptoms that either as a patient or as a medical professional, someone will be looking for to help diagnose or refer to diagnose this disease. We're going to talk about diagnostic tools, so how you actually can get psoriatic arthritis diagnosed. We are also going to talk about medical management. So if you have been diagnosed with psoriatic arthritis, what medications can help you relieve the symptoms. And lastly, we're going to talk about the importance of physical therapy with psoriatic arthritis. This is just a copy of the handout that I've made for this presentation. To begin, we are just going to talk a little bit about what psoriatic arthritis is. So it's just like this slide says, it's chronic inflammatory arthritis that occurs in people with psoriasis of the skin or nails. A little bit more about psoriasis, it is when your skin is red, itchy, scaly, patchy, and it occurs in areas like the elbows or the knees. And your psoriasis can actually go undiagnosed, but you can still develop psoriatic arthritis from psoriasis. And if you do have psoriasis, about 4 to 30% of people who have it will develop psoriatic arthritis. Now, the arthritis part is when the joint becomes involved. So you have the psoriasis, the red, itchy skin, but you also have the joint that swells, it's inflamed, it's tender, it's stiff. So it's just a combination of the both diseases. And then just a little bit about this is that this disease actually affects men and women very equally. Next, we're going to talk about the etiology and pathogenesis of psoriatic arthritis. So that just means what is causing this to be developed. So the first thing is genetics, and that is just something in your genes passed down causing this disease to develop. Another thing is what people will see in blood test is if you have an increased HLA-B27 that will interact with cells in the blood and can increase the inflammation at a joint, leading to psoriatic arthritis. Another thing is just your environment. Things in your environment could irritate your skin, causing psoriasis and then leading to psoriatic arthritis. And lastly, it could be chronic inflammation. So you have some type of infectious agent or injury occurring that causes inflammation at a joint to be chronic, and that can lead to psoriatic arthritis. Next, we're going to talk about the signs and symptoms that are accompanied with psoriatic arthritis. So as I mentioned before, psoriasis usually occurs first and then will lead to psoriatic arthritis. Your symptoms can be asymmetrical, meaning if you have it in your right elbow, you won't necessarily have it in your left elbow. And then the skin and joints that this are very common at is your hand and toe joints, your eyes, your nails, your elbow, and your knee. And you can also develop tenosynovitis and enthesitis, which is just where tendons attach to bone or where ligaments attach to bone, it can be very inflamed. And then we also know that this is a very damaging or destructive disease to your joints. So if you're looking at scans, you can just see the degradation of the joints. Next, we're going to talk about diagnostic procedures for psoriatic arthritis. So there are blood tests that can be done that test for inflammation factors in the blood that are just causing the inflammation at a joint. And then you can also do radiographs or MRIs, which are just looking more in depth at the joint to see if arthritis is present. Next, we're going to talk about the medical management of psoriatic arthritis. So that just begins with treating the psoriasis. So just trying to live a healthy lifestyle, taking baths, using moisturizers, creams, ointment on the psoriasis, and just trying to avoid any triggering things that will increase the psoriasis in the skin. And then for the arthritis, you can take methotrexate, biologics, or JAK inhibitors, which just work to reduce the inflammation in the joint. Lastly, we're going to talk about the importance of physical therapy with psoriatic arthritis. So physical therapists can provide education and treatment plans. They can help patients maintain joint movement, increase their range of motion, and reduce inflammation, which will all just increase the patient's quality of life. And it is recommended that patients do things like stretching, strengthening, and aerobics, but if those are aggravating, physical therapists can provide alterations to make them less aggravating.